This is TTT Live. I'm DK Rostar. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Chalk City 91.1 FM, and on Facebook at TTT Live Online. We go now to the Manager Corporate Communications for the Ministry, Candice Alcantara.
Good morning. Today is Saturday, the 22nd of August, and thank you for joining the Ministry of Health's virtual media conference, which will provide an update on the COVID-19 response. Today, I am pleased to welcome back to the panel the Honorable Terrence Deyalsingh, Minister of Health. We also have with us Dr. Roshan Parasram, Chief Medical Officer, who will provide the clinical update, and Dr. Naresh Nandram, Principal Medical Officer, Epidemiology, who will provide an update on COVID-19 testing. I am Candice Alcantara, Manager Corporate Communication at the Ministry of Health, and I will be your moderator this morning. We will jump right in. I invite the Minister of Health to deliver his presentation.
Thank you very much, Candice. Good morning to the Chief Medical Officer and Dr. Nandram. A very good morning to ladies and gentlemen of the media. We meet again. And to all members of the listening and viewing public, wherever you are. Ladies and gentlemen, at a stakeholder meeting on Thursday gone, which included officials of the Ministry of Health, the University of the West Indies, PAHO, CARFA, TPHL, Chiefs of Staff of Port of Spain General Hospital and Eric Williams Medical Sciences Complex, chaired by myself. In dealing with this cluster phase of coronavirus, which many countries of the world are facing, we have set a strategic objective to move the country from community spread back to cluster spread in the shortest time frame possible. Now, I can't give you a date because there are so many variables, but the strategic objective is to go back to cluster spread where we could identify clusters and lock down clusters as we did before. To achieve this strategic objective, it is going to call for total solidarity across the country, political, social, society, and all systems to be working and in sync with each other. However, there are two parts of this system that recently, one part under the control of the Ministry of Health, which I admitted to last week, Saturday, needs to be improved, and I will come to that, and also the other part of the system that needs to be improved. If we are to move the country back into cluster, we need to ramp up our testing, which we have done. The weakness, as we identified and which we admitted to, was the reporting. And this morning here now, I want to sincerely apologize to all of those persons in our step-down or quarantine facilities who have not yet received your results. I humbly apologize. I can only imagine the anxiety that you are going through because you did not call this upon yourselves. So I do apologize, but Dr. Nandram will explain to you what we have done in the past few days to ease your anxiety, and we hope to get your results in the shortest possible time frame so you can go back home. So I do apologize and simply ask that you bear with us for another day or so. It is not your fault. As we admitted that we were simply overwhelmed with the thousands of samples coming in. So we are fixing that, and I will explain what we are doing to fix testing, and Dr. Nandram will go into the details. The quarantine and isolation facilities, we are ramping up those, and I will give you some details in a short while. The contact tracing continues to be robust. That is good. Care and management at our facilities continues to be exemplary, especially at the hospital setting, where the most serious cases go. And the last part, which we need a lot of cooperation from, which is not working. Remember, I did say two parts of this were not working. Testing, and now, unfortunately, The other part that is not working is public cooperation. We have not been getting as much public cooperation as we would like. And I will just refer to one article in today's Newsday on page 7, where the police had to go into an area to shut down a party. This is contrary to what we have been seeing all along, that gatherings, whether in the public domain or in the private domain, is the major risk. We can build out all the facilities, but if we don't get the cooperation of the public to conduct themselves in spaces which you have total control over. You may recall last week, Saturday, I asked the population not to have any gatherings at home, no barbecues, no birthday parties, no anniversaries, no weddings. And it was very, very disappointing to see that the police had to shut down a 32 people event in a home. This is how we cannot flatten the curve, and this is how we cannot go back from community spread to from community spread to cluster spread. What are we doing at the ministry? Because we can do this together. We can do this. We are increasing our testing capacity. We are resourcing it. We are increasing our quarantine and step-down facilities. Yesterday, I visited both TPHL, and Dr. Nandram will go into details as to how we have brought down the backlog in testing and what we are doing to ramp up efficiencies there with resources. Yesterday afternoon, I also visited the Penal Debe campus, where we are going by the end of the week to bring on an additional 110-bed quarantine or isolation or step-down facility. Under UTT at the Deyalsingh Teachers College, we are going to have a new facility there. We have also taken a decision this morning that learning from the global experience with persons in long-stay homes, I have spoken this morning to the president of the association that manages these long-stay facilities. The two major subpopulations we are concerned about are school children. So we have taken a decision not to open schools until January and keep them safe at home. That is one. But the aged, although we have been working with them, bearing in mind now we have community spread, we need a different, slightly different approach to homes for the aged. Because in countries that did not manage this properly, over 50% of the fatalities came from these homes. So in discussions with Dr. Rohit Doon, who is the point person for dealing with homes for the aged, and Ms. Carolyn Ruiz, who is the president, we took a decision this morning that we will now reserve the Brooklyn Center in Sangre Grande for any possible patient who is in a home for the aged, who may be exposed to the virus, or who needs more advanced clinical care to be taken into that setting where we will put in specialized medical care to care for those people. We will draw up the clinical criteria over the next couple of days, and Dr. Doon and myself and the CMO will be in contact with Ms. Ruiz to share the criteria that we could take out persons from these homes who fit the clinical criteria and take them into this specialized, if we use the term bio-bubble, to make sure that we treat our elderly in the most compassionate and careful manner. What is the current status of our facilities across the board? They are not overwhelmed, and I will give you the figures. In the hospital setting, we have a capacity of 420 beds, and I'm told by the Chief Medical Officer this morning, we are currently using 143? Correct. So we are less than 50% there. At the step-down facilities, we are about 50 to 60%. So there is capacity. In addition to the step-down facilities, which we currently have of about 360, we will be bringing in, as I said, Penal Debe campus by the end of next week with 110 beds, and UTT with another 100 to 150. So there is going to be capacity. However, physical capacity is one thing, but the human capacity to man these systems is finite. We can add as much beds as we want, but we need doctors, we need nurses, we need drivers, we need admin assistants, and some of our healthcare workers are already complaining about burnout. I am appealing to those, like those who threw this party that the police had to shut down. This is what is going to overwhelm our system. The responsibility is a shared responsibility between government and the public. So I need the public's cooperation to behave as we did in the first phase of the lockdown, where you only venture outside to go to the grocery, to go to the pharmacy, to go to work. We don't need orders to do that. If we can all pretend we are back into the lockdown phase, we can flatten this curve again, and we will flatten it. We will flatten it, but we need the cooperation of the public, because we don't want to overwhelm the system both physically, and we don't want to overwhelm healthcare workers. I have to keep an eye on healthcare workers and their health and their safety. So I am appealing to the public as I close to conduct yourselves in a responsible manner, wear masks, social distance, wash your hands, and most importantly, stay home if you are ill. And as I close, I again want to apologize to those members of the public who are in our step-down facilities awaiting your results. We are working overtime to get your results in the soonest possible time so that you can go home to your loved ones and to your home environment. Thank you very much, Candice.
Thank you very much, Minister Deyalsingh. And now we move to the Chief Medical Officer, Dr. Parasram.
Hi, good morning. Thanks, Ms. Alcantara. Good morning, Honorable Minister, Dr. Nandram, members of the media, members of the viewing and listening public. The clinical update for the 22nd of August 2020 is as follows. The total number of samples submitted to all labs, 18,735. Repeated samples, 2,276. Unique patient tests completed, 16,459. Positive tests now stand at 899. Active cases at 721. 35 additional positives were received between 4 p.m. yesterday afternoon and this morning. They were 28 from the Eric Williams Medical Sciences Lab, 3 from the Sangre Grande Hospital Lab, and 4 from private hospital labs. These samples were taken, swabbing was done between the 16th and the 21st of August. In terms of our hospital cases, as Minister had indicated, we have 143 persons at this time in a hospital secondary tertiary care facility. At the Cora facility, we have 42 individuals, all doing clinically very well, very stable. At the Cuba Hospital and Multi-Training Facility, we have 101 individuals, 5 of which are in ICU. As you recall, that's the highest level of care, and HDU, 2 individuals at this point. Within our step-down sites, we have a total of 283 persons. The UV Canada Hall, there are 136 persons, 56 persons being transferred from the Cuban Cora facility late yesterday between the last 24 and 48 hours. At the Debe campus, we have 55 persons in total, 9 persons again transferred yesterday into that site. At the Tacarigua site, we have 35 persons. At the Balandra site, there are 23. The Brooklyn site, we had 10 transfers in, taking us up to 28. And at the Napa site, where we have a step-down facility for our healthcare workers, we have 6 persons there at this time. With our quarantine sites, which are the persons that have been repatriated into Trinidad and Tobago, we have 177 individuals. At the Cascadia Hotel, there are 40 persons. Chancellor Hotel, 16. Regent Star, 29. And Paria Suites, we have 92 people who we hope that should be discharged either later today or tomorrow, those 92. By way of our changing epidemiological picture, we have adjusted some parts of our discharge criteria and our step-down criteria to cater for where we are at in the epidemic. So, as we have said over a week ago, we are in the community phase. It means that generally in the population, there's a higher risk of contracting COVID-19 within the population. So there are two changes. One, in terms of going from a secondary or tertiary care facility into a step down, our criteria is now basically for persons without comorbidities, very well individuals, young persons, remaining asymptomatic for 1 day. So they have the onset of symptoms, their symptoms disappear, they become asymptomatic for a 24-hour period. Those individuals can now be put into a step-down facility, which is a lower level of care. Once you get to the step-down facility, then there's another criteria that kicks in. In terms of the high-risk individuals, those with diabetes, hypertension, chronic obstructive pulmonary disease, asthma, the elderly, we are looking for 3 days being asymptomatic. And once you get to that 3 days, then you can step down into a facility, but it is based on your clinician's determination at that point. So both in Cora and Couva, the clinicians there will make that determination as to when you are stepped down, but those are the general rules of thumb. In terms of our discharge criteria from the step down to go back to your homes, we have had a change there as well in alignment with the WHO's recommendation for countries with community spread. They recommend basically two general categories. So there are symptomatic patients, persons that have any form of symptoms, whether mild or otherwise. They have to spend 10 days from the date of onset of your symptoms, plus 3 days asymptomatic. And what we are using in Trinidad is 1 negative smear at day 3 of having no symptoms. In terms of persons who never had symptoms from the outset, we are looking at repeating. So from your date of positive smear, we are repeating your test at day 10. Once you have that negative, you can be discharged home as well. So, Candice, that's my clinical update for this morning.
Thank you very much, CMO. And now we move to an update on COVID-19 testing from Dr. Nandram.
Good morning, all. Good morning to the Honorable Minister Terrence Deyalsingh, Minister of Health, the Chief Medical Officer, Dr. Roshan Parasram, Manager, Corporate Communications for the Ministry of Health, Ms. Alcantara, members of the media, and members of the viewing and listening public. Good morning, all. I'd like to begin my presentation today by speaking about testing and reporting. So one of the critical areas in managing COVID-19 is testing and also reporting of results. I'd like to speak about, firstly, the capacity of Trinidad and Tobago to do testing and the responsibilities of the public as it relates to that, and how seriously people take those responsibilities and how that impacts testing. The challenge that we've been having is that persons who test positive undergo a contact tracing process, and this results in a number of contacts that we then subsequently need to test to determine if they are positive. When symptomatic persons, when persons who have a cough, a cold, stay home, that list is very small. Members of the immediate family, maybe 1 or 2 persons that visit the home. However, if persons do not adhere to the guidelines that we've been advising, if persons are ill, they're symptomatic, and they do not stay at home, that list becomes a lot larger. Persons go to work, they used to go to school when schools were open, they visit the banks, supermarkets, and that list becomes very, very large. So from a singular case, we can end up with hundreds of persons that we need to test, not once, but multiple times during their periods of quarantine. So I implore the members of the public, again, please, if you are ill, please stay home. It only puts additional strain on the testing of persons, and it only creates a larger web of contacts that need to be traced. So in addressing the capacity issues, the Ministry of Health has taken several steps to increase our ability and the volume of samples that we can process on a routine basis. One of those measures that we've taken is we have activated the Medical Research Foundation to do testing for COVID-19. That machine across the MRF has undergone the validation panel, and we're hoping to get a feedback from CARFA today or across this weekend as to whether or not we can start testing. If As long as the CARFA gives the green light, we are ready to start testing as soon as Monday. Capacity at Eric Williams is under consideration for expansion. I've received a proposal requesting the consideration of an additional machine to boost capacity out of the Eric Williams site. And in addition to that, approval has been granted and funding identified to procure a PCR machine to establish a molecular testing service for COVID-19, among other diseases, at the Trinidad and Tobago Public Health Lab. So in addition to increasing by expanding the number of sites and capacity within specific sites, we're also moving to have these labs run on a 24-hour basis. That would entail additional staff, rosters, and additional supplies, additional equipment to ensure that these labs, now running on a 24-hour basis, can increase our throughput. To address the issues with regard to reporting, when we started testing for COVID-19, the traditional method of sending a physical paper request form to the lab and having a paper form sent back was found to be very, very inefficient, and the ministry wasted no time in seeking a digital solution. The ministry is cognizant of the fact that in this age of technology, we must leverage the advantages that technology brings to help us in this fight against COVID-19. With that in mind, the decision was taken to expand the digital network of the Trinidad and Tobago Public Health Lab Information System into all the RHAs. What this means effectively is that the era of paper-based forms is coming swiftly to an end. Discussions have already taken place between the ministry's IT team and several RHAs, and CARFA stands ready to support with their technical end with the rollout of the lab information system across the country. What we're looking to see happen in short order is that a COVID-19 test would be requested digitally at the point source within the RHA, meaning someone would sit at a computer, they would digitally enter the patient information, and the only thing that would be sent to the lab is a one-page line listing and the samples. And the samples now, being already digitally entered into our system, would go straight into the testing procedure, and the lab, on testing the sample in reporting, reports directly into the very same digital system. So the lag time between the lab updating the digital system and the result being available on the clinical end in the RHA anywhere in the country would be brought effectively to nil. And this is as close to real-time reporting as can possibly be had. So we're working actively and feverishly in rolling out the system. And another thing I'd like to highlight is, in addition to the increasing capacity by way of increasing the number of laboratories and running the labs in a 24-hour system, with several other key bits of equipment that we're bringing in. We're looking to procure additional PCR machines and additional nuclear material extractors, which feed the PCR machines to do testing. In so doing, in addition to bringing on additional staff, we'd let the machine. We'd use equipment to do a lot of the heavy lifting that at the moment we've been leveraging staff to do. So in so doing, we hope to increase throughput available to the public dramatically. That brings me just to a summary on the number of samples that we have left for testing. As of this morning, we have approximately 600 samples left, and that's after we leverage one more tweak to our system. To clear the remaining backlog of samples, we've leveraged utilization of a private lab that was willing to accept samples from us. The samples went across yesterday, and we hope to have those results within 24 to 48 hours. The remaining samples we hope to clear within the week. 600 samples is well within the daily capacity, but I'd ask the public to be cognizant of the fact that 600 samples is not all the samples that we receive. Samples are continually brought in day and night to the laboratories, and with our current throughput, especially after the Medical Research Foundation comes in, we should be able to handle that backlog in short order. So I trust that by this time next week, there should no longer be a backlog of samples awaiting testing, and we should be back to our routine reporting within 24 to 48 hours. At this point in time, I'd like to just go into a few slides as it relates to where we are in this pandemic. So can we put up slide 1, please? So I'd just like to update everyone on where we are in terms of the age and sex distribution of cases. In terms of our male to female ratio, we still have a preponderance towards females, just a slightly more females than males generally overall. And the average age of persons that contract COVID-19 in women, we're looking at an average age of 40 years old, and men an average age of 41 years old. Now, this does not mean that these persons are the only age group that can get COVID-19. We've had, if you'd look at the graphic on the lower left corner of the screen, you'd see that we have persons ranging from the very, very young, and the very, very old, and this happens fairly frequently in the home setting. When a positive case is found in a household, the household are the persons that are usually at highest risk. They're the persons that are in most frequent contact and in contact usually with the positive case for the longest period of time. So the persons that you are most likely to infect if you have COVID-19 are in fact your very own family, and we've seen clusters of cases occur in family homes time and time again. The other place that persons spend a lot of time would be in their workplace, and we often get lulled into a sense of complacency because of a familiarity with our co-workers. You know, we don't sometimes use masks when we should be using them, and I would encourage persons at work, if they cannot social distance, please wear your masks. Please, please do, because a singular case within an office can then trigger many, many members of staff being put on quarantine if masks are not worn, and measures such as social distancing and hand washing are not adhered to. So I'd like to ask for slide 2, please. Now, these two histograms, or bar charts, if you will, show there's a bit of overlapping information between the two of them. The bar chart at the top shows the last month. So we're just about 1 month in from our first locally acquired case. And as you'd see in July, there weren't a lot of cases coming in. It was a very slow, it was a comparatively slower period. And if you look at the period of August, you'd see that we got significantly larger number of cases, and that, we really saw a log phase of growth during that period. The graph on the bottom shows August in isolation, and these figures are some of the highest that we've seen thus far in the outbreak, and these figures are compiled by the date the sample was taken. So each day represents the number of samples that were taken on that particular day, and it's a much more accurate and a much better way to represent our current situation than taking the number of cases that are reported in a day. These figures, these bar charts are based on the day the sample was taken, and it really reflects the number of people that were sick on that particular day that presented for testing. I'd just like to move to the third. So these are the daily COVID-19 positive cases by the date the sample was collected, and it spans from the 20th of the 7th right down to the 18th of the 8th. So from the 20th of last month to the 18th of this month. And this really brings to into focus the rise in the number of cases that we've seen across the last month or so. Very early in July, as I've mentioned before, we saw a slow increase in cases, and that picked up pretty quickly during the month of August. We've seen a comparatively lower number of people in the last few days coming in positive that were tested more recently, but I don't want to hang my hat on that just yet because we still have some samples outstanding, and I'd just like to highlight that and bring that to the attention of the general public. This does not necessarily mean that our cases are going down, as indicated by the dashed trend line there. Until all the data is in, I'll reserve comment on that, and I'll just say that this is the data that we have so far to work with, and that trend line for those last 2 days on the 17th or 18th until all samples are reported for the 17th and 18th. I'm not going to put out that this is accurate until we have all the results in. That ends my presentation at this point for today, and Ms. Alcantara, I'll pass back to you.
Thank you very much, Dr. Nandram. And straight into the question and answer segment. I know that our media representatives have many questions ready. Please indicate your name and the media house that you represent before posing your question. We ask for a maximum of 2 brief questions per media house, please. And of course, if we have additional time, we will accept another question or 2. And we begin with Guardian Media Limited.
Hi, good morning. This is Soini Gray from CNC3. I wanted to ask, is there we have a 13th person who died, a male. Is there an emerging profile of the type of persons who are dying from the virus? Since this has been, we've had at least 3 recent deaths. And my second question is either for Dr. Parasram or the health minister. The health minister spoke about, staff is experiencing burnout. What is being done to boost staff capacity in the short term? Any plans to recruit? I know we had some persons coming from Cuba, or maybe train up local staff or tap into our medical students, either from student nurses or doctors. Those are my 2 questions.
So I'll take the second part first, and then we'll go to the Chief Medical Officer. As far as staffing is concerned, about 3 months ago, we took a decision to train some intensive care unit nurses. That has been done. They finished their training maybe about 6 or 7 weeks ago, CMO. So right now, we are in a good place as far as intensive care unit nurses are concerned. We have brought on in the past 2 weeks, and CMO could correct me if I'm wrong, about 25 doctors, 50 nurses. But it's not only medical staff. We are also bringing on support staff because you need drivers to transport samples. You need admin assistants to do the database entry. So we are expanding and hiring people across the spectrum of services that we need. Clinical, paraclinical, and admin support. So that is being done to strengthen every part of the system, from TPHL, the CMOH's office, Ministry of Health. So we are doing that to prevent major staff burnout. But what is always lost in these conversations is not only what the ministry is doing. We must always say, what is the public doing? Because yes, we have facilities, but the facilities are not there for people to go out, be reckless, and then use the facilities. we have the facilities, so you get sick at work, that is getting sick pursuing a productive endeavor. Let's use the facilities for that. Because I am getting some reports that 1 or 2 bars are closing their doors, putting on their TVs, so patrons can watch CPL cricket in an enclosed environment. Now, that type of behavior, in addition to the party which the police had to shut down, is what is going to give us problems. So we need the public's cooperation to make sure that we don't have to use all the facilities and our staff don't get burnt out. So I am hoping we get the cooperation of everyone. You know, stay home, only go out for necessary purchases and to work. Thank you very much.
Okay, in terms of your second question, as you know, we had 13 deaths so far. They have more or less mirrored the international sort of descriptions that we are seeing, meaning elderly persons with comorbidities like diabetes, hypertension, obstructive pulmonary disease. More or less, we are along those same lines. There are a couple outliers in between, which would have been from younger age groups. However, they would have had other comorbidities to the most part. So we are mirroring, in terms of the deaths, what we are seeing in the rest of the world, in terms of the category of persons that are dying from COVID-19 in Trinidad and Tobago. Candice?
Thank you very much, CMO. And now we open the floor for questions from 98.1, please.
Good morning to you, Ms. Alcantara. Stephen Cummings here, 98.1 FM, and good morning to the panel, Deyalsingh and CMO, Dr. Landgram. 2 questions quickly, one for Minister Deyalsingh and the other for Dr. Parasram. First, I start with Minister Deyalsingh. Minister, welcome back, and
thank you.
Congratulations on your new mandate.
Thank you.
Doctor, I will start with Minister Deyalsingh. A report today, Minister, claims that the Prime Minister, Dr. Keith Rowley, was forced into quarantine after supposedly inadvertently coming into contact with a suspected COVID-19 case. Are you in a position to confirm or deny such a report? And Dr. Parasram, with the jump in cases being discovered, especially in the last several days, there is also the rapid increase in the use of body thermometers. Questions have also been raised on the possible harmful radiation effects to the forehead when it is used in that way. Can you tell us about the use, quality, and procedure for employing proper body temperature checks? Because this can obviously be, or it is, in fact, a critical entry point. Thank you.
So thank you very much, Mr. Cummings. Nice to see you again. So I have the Prime Minister's express permission to speak about his testing. And I did say on TV6 last night, and I will repeat it, the Prime Minister would have contacted me on, today's what, Saturday, on Thursday night, to say he got a notification that a COVID positive patient, that he was in contact with that person. So yes, and 5 members of his family were indeed tested. So I could confirm that the Honorable Prime Minister has been tested, together with 4 other members of his household, and all the tests are negative.
Okay. So in terms of your second question, the use of thermal scanners for basically checking symptomatology. Fever, just to remind everyone, fever is only one symptom of COVID-19. There are many symptoms of COVID-19. So you could have a runny nose, you could have loss of smell, you could have loss of taste, you could have a cough. Fever is one symptom. It does not present itself in all cases of COVID-19 that we actually have a fever. And again, in terms of exposure, persons who don't have a fever can still spread the virus just as well as someone that has a fever. In terms of your direct question related to the use of thermal scanners on the forehead, it can also be used on the wrist, and to good effect, because your wrist in most instances tend to be less exposed to the heat in Trinidad and Tobago when you get out your vehicle, or even conversely to your air condition in an air-conditioned space. So there's less variability in terms of the temperature at your wrist maybe than on your forehead. So both areas can be used effectively, but what it gives you is a point temperature reading at one instant in time. It does not say that you don't have COVID-19 when you have a negative temperature. It just says that you don't have a fever. So that's what we're looking at. It is not to be used as a singular check to see if you have COVID-19 or not. It cannot do so. But it will tell you if you have a fever or not. So we ask that the business places also ask your employees, if you have other signs and symptoms, please stay at home. So we're looking for other signs and symptoms in addition to fever. Okay?
Thank you very much for that clarification, CMO. And we move to TTT.
Hi, good morning. Minister Deyalsingh,
Yes.
there has been a report within the past week on BBC that people in England who have recovered from COVID-19, they are being urged to donate their blood plasma to help persons, current COVID-19 patients who are struggling with the virus. They're saying that the antibody-rich fluid can help with this process. Is this being considered in Trinidad? And secondly, we just want to get some clarification in terms of the media release, where they're saying that the health media release this morning, patients en route to being admitted to hospital, and there's new patients that will be processed for admission. Can you offer some clarity? What is the difference with regards to that?
Thank you very much. So I will take part of the question and then the CMO will take the other parts. At the start of the press conference, I did indicate I had a stakeholders meeting on Thursday. And strange that you should ask, because that same topic about using serum was raised. I raised it with all the experts because I read the same thing. I raised it with PAHO, the university, Professor Cummins, and there was agreement, CMO, if I remember correctly, that that is not applicable to our setting. But you could explain more. But it was a matter raised, and the CMO will go into the clinical details, but it was raised.
Yeah, so basically it is a purported new type of treatment that is being trialed. There's still no WHO approved treatment for COVID-19, and I think that's the most important point. So as you have noted, we had said before that there's a trial, which is a Trinidad and Tobago arm of a WHO trial called the Solidarity Trial, which the University of the West Indies are the principal investigators into. They will be giving basically patients the option to volunteer to be part of the trial, to use a number of drugs to see if there's any benefit towards COVID-19, thereby adding to the world population of testing to see if there's a treatment that can be used worldwide. But as of now, there's no treatment that has been sanctioned by WHO for COVID-19, and the mainstay remains supportive care, which we are using in Trinidad and Tobago.
And I think there was a follow-up question.
There's a second question related to the descriptions on the press release. So basically, en route means that you physically have already tested positive, you have been contacted by your CMOH office, told that you are positive, and that arrangements are being put in place quickly to have you brought into the hospital via ambulance. Processing means that, for instance, we would have had 35 new cases this morning. They may not have already informed those individuals that they're positive, so the process is ongoing in terms of information to the patients. So they haven't gone ahead. It's just one is a little step ahead of the other. So processing means that the results are being processed, sent out to the respective CMOHs. Usually the physicians or the CMOH in charge has to give those results to the patient. There's some element of counseling as well. So that's what processing means. Going beyond, you have en route, which is that part is done, and you have persons now physically being brought from their homes into the facilities. Okay,
let me just put a final punctuation, because Sunil, you raised a very good question about the plasma testing, COVID-19 and convalescent plasma testing. I'm just checking on the FDA. As of now, because things can change, so don't hold me to it. As of now, there is no FDA-approved convalescent plasma test that could be used safely. Everything right now is in trial. Okay, so I hope that really clarifies the question, but it was a good issue to raise. Thank you very much.
Thank you, Minister and CMO. And now we move to AZP News, please.
Hi, good morning. Priya Bihari, ACPnews.com. Welcome back, Minister Deyalsingh.
Morning, Priya. Thank you very much.
I wanted to discuss a little bit about the testing and the reporting. I think last week Minister, you said that by Friday we would have had the reporting done within 24 hours. And now Dr. Nandram is saying we have to wait another week again. But my issue is that sometimes when people are tested, they wait a week, maybe two, to get the results, and they go home, they stay at home, and they infect their loved ones, for example.
Yeah.
So that is an issue. I think that is a lapse in the process.
Yes.
I don't know if you're going to fix that, or how you're going to fix that one. And my second question is, when we dealt a while ago with case 139, you also said that that person had no travel history. I don't know if you found out how that person had contracted that. I don't know if you can tell me about that. Thank you.
Sure. Thank you very much for again raising the issue of testing prior. So I did say, and Dr. Nandram has the details. Right now, I don't think Dr. Nandram could speak to it. What is the current lag in testing to tell you from what dates we have to cover? So Dr. Nandram, because we have taken steps to clear up a lot of the backlog. Mm-hmm. Dr. Nandram, if you could tell us from what dates now we have tests to clear as you bring it down.
So the reporting that we did today came within a range of dates from about the 18th thereabouts, 17th, right down to the 21st. The backlog that we have today really only goes back that for samples that received in the last 2 days or so. So it's not that persons have been sitting at home for a week. In addition to that, clinical cases are always prioritized. And it's for that reason that some persons that are already sitting in quarantine where they are not in contact with members of the public, they're not moving around, they're not in contact with members of their own family. For example, persons that would have been repatriated, those persons that are sitting in quarantine, persons that are already suspected and have been brought into suspect facilities to look over their clinical management while they're awaiting a result for a test. Those are the ones that we tend to put at a little bit of lower priority. So we would rather have prioritize the urgent clinical patients, of course, always get top priority. We also prioritize our healthcare workers and the persons that are flagged by the team, the clinical teams, taking their samples as maybe this is likely COVID, and I'm concerned. So it's not as simple prior as first in, first out. We're cognizant of the clinical urgencies, and if we adopt a simple first in, first out, given the situation, then patients that are very, very ill could be made to wait unnecessarily. And it's for that reason that sometimes when we report, you find a sample that has stuck around for a few days. But like I said, we've tested samples as current as of the 21st. In fact, there's samples that have been reported on today already. The sample arrived at the lab today. The sample was tested today. And that's happening increasingly as we roll out on point of care or near point of care testing. So far, this has happened at the Scarborough General Hospital and the Sangre Grande General Hospital. So, for example, prior, if a patient walks into the accident and emergency in Sangre Grande Hospital, theoretically, they could have a result in under an hour as to whether or not they're positive or negative, depending on the throughput of the hospital at that particular point in time. So we're working on the backlog. We're cognizant of that, but it's been done in a manner to do two things. One, minimize general risk. Persons sitting at home with their families, we try to prioritize those. Persons that are at clinical need, the very sick persons in the hospital, the persons that the medical chiefs of staff reach out to say that, listen, this is a person with severe acute respiratory infection. We prioritize those. And it's kind of for that reason that some of the persons that are already sitting in quarantine have been delayed a little bit. In moving forward, I'd just like to just reinforce that the volume and capacity is of course correlated to our behavior as members of the public. If we wear our masks and social distance and wash our hands routinely, then we protect ourselves, but also those around us. And like I've mentioned, we're seeing a lot of persons infecting their own families and persons in their workplace. So I will encourage everyone to please minimize your risk when you go out, because that's where the initial case in any household would come from. Someone from that household would have gone outside the household, contracted the disease, and then brought it back home, and then in turn infected their household. So whenever you're out in public, please wear masks. Please be responsible if you're symptomatic. If you're symptomatic, please don't go out in public. Please stay home. And I hope that addresses the question prior. Back to you, Ms. Alcantara.
Thank you. And I think we had a second question from AZP News, an update on patient 139.
Update on patient 139. Okay, so what was the question about patient 139, prior?
Travel history.
Oh, not hearing him at all.
That there was no evidence of how the person had contracted the COVID-19. I just want to find if you have found out where the person had contracted it.
189 is the first one. So, what I had alluded to before, I mean, there was some persons throughout, including, I don't want to point out a particular case, right? There are cases throughout that would have had what we call induced spread, meaning contact with persons that would have had recent entry into Trinidad and Tobago. So that has been a feature of phase 2 in certain instances, especially in the early days. But at this phase, the majority of cases that would have contracted it would be via local spread. And basically what we have is a situation where we have, as I said, we've gone beyond cluster. So you have community transmission, means that you can get it from anywhere within Trinidad and Tobago. So most of the cases that we have now are of that nature. But in the early days of phase 2, we would have had some induced cases.
Okay, thank you, CMO. And we move now to TV6.
Good morning, everyone.
Morning.
Good morning. Alicia Boucher from TV6. I have two questions. One is a two-part question. The other is from a member of the public. Now, I can't confirm or say whether this is fact or not, but we understand that the 13th fatality, number 13, that person was waiting in hospital for around 7 days to get a test result. The doctors couldn't treat him, and he would have unfortunately passed away before it was determined that he had COVID-19. So in light of that, I would like to ask, how far along are we in terms of that digital system that Dr. Nandram would have referred to that would allow for real-time reporting? And maybe you can just elaborate a bit on the process for that so that we can have a clearer idea when do we expect to get that by. And in addition to that, given the high number of tests that are being done, if you can just update us on the number of test kits that we have. So that's the first two-part question. The second question, we have a question coming in from a religious leader of the SDA, and they would like to find out whether or not they can, behind closed doors, comply with the requisite number of persons, which is 5 right now, and record services to stream to their members. Thank you so much.
Okay, so I will deal with one of your many questions. Alicia, you're laughing. The last report I have on test kits, which is a couple days old, because I get a report every Monday morning, is that at a couple days old, we had about 19,000 test kits. We have coming in a few more, 20,000 from Canada, another 100,000 from another source, another 20,000. So as far as test kits are concerned, we're in a very good place. What I can also see, the Gene Expert machines, which we have currently in CARFA, ERHA, TRHA, and to service Northwest. We have already, because the supply chains are now opening up, we have ordered 25 more Gene Expert machines to place in all of the major institutions, including district health facilities like Couva, Shogunas, Siparia, wherever you have these 24-hour health facilities. We'll put one in Cora and all the major hospitals because supply chains have now opened up and there is now capacity. So we have ordered 25 more Gene Experts together with 25,000 more kits. So that is where we are with kits now, Alicia. Thank you.
Yeah, in terms of your patient, without giving out anything about the patient, but it's a good question. Clinicians don't treat test results. We treat patients, right? So each patient will be treated on their merit, based on especially seeing that we have no specific treatment for COVID. We will treat the patient symptomatically to the best of our ability, whether we get a test or not. So all patients that are admitted, whether they suspected, they confirmed, they'll be given the utmost level of care by the clinicians, and they have been given that throughout the institutions in Trinidad and Tobago. And it's an important point to note as well if you're at home. So there are a number of people that would have been tested. Our rate, I think, of positivity is 4.36%. So every 100 tests we do, we pick up 4.36% of people that actually have a positive. It means that you have 95 people out of 100 that present our facilities with viral illnesses that are negative for COVID-19, meaning that we do have other viruses in circulation. If you are at home and you are waiting up a test result that has not come, one, you have to make sure that your symptoms are not getting worse. Don't wait for a COVID test to determine whether you should go to a facility. So if you're at home and you have worsening of symptoms, you have increasing shortness of breath, abdominal pain, vomiting, you're unable to eat or drink, or you have feeling of extreme tiredness, dizziness, you're having anything that is, in your view, increasing in severity, you don't wait on a test, you go straight to a facility, you contact your healthcare providers. So most importantly, the testing, as Dr. Nandram has indicated, is we are improving with time so that we can get up to date in the shortest possible space of time based on the number of tests that we are getting in our system. So once that is up to date, it of course will help in terms of knowing who is COVID-19 positive and who is COVID-19 negative at the outset, and determining who needs to be transferred into the facilities, thereby increasing our capacity to do contact tracing and controlling. And the second most important thing is if you have any viral illness, whether it's COVID-19 or not, you should stay at home if you are ill. Because what the risk we have is people at home waiting for your test. You are ill. You don't know if it's COVID-19 or some other viral illness, and you're leaving your home and spreading it around. So we're asking people, COVID-19 or not, we make sure you stay at home if you're ill. Candice?
Thank you very much, CMO. And as we come to the close time, we just remind the media, please, 2 brief questions. We move to Guardian. I see Annalisa Paul there is waiting.
Good morning to the panel and Minister this morning. I'm just trying to find out if you could give us an update on the Prime Minister would have spoken last Saturday about the mandatory use of masks, and I'm trying to find out whether or not that legislation, any headway has been made with that. And in terms of the Minister, you referred to the burnout by nursing personnel and doctors as well on the front line. We have received reports of nurses and doctors as well complaining of that. Can you say how soon we can get extra staff, additional staff going into these to supplement them at this time?
Thank you. So extra staff, as I indicated earlier, have already been hired. But it is up to the public not to test the system. On the issue of masks, I spoke to the AG this morning. The legislation is being drafted, but it will need Parliament to sit because it cannot be done via legislation. It has to be done via an amendment to the Parent Act, which is the Public Ordinance Act. So that is where we are. Parliament has to sit to pass that particular piece of legislation. But thank you. Excellent question.
Thank you very much, Minister. And last questions now from Newsday.
Good morning, Janelle D'Souza from Newsday. We have heard about the burnout on the staff. However, we've also received a few reports about medical staff not wearing masks at all, especially in clinics. What is the recommendations there, and is there some way to enforce it? Also, the hotline, COVID-19 hotline, there have been issues with some people not being answered at all. How is this being addressed?
Okay, so I will deal with part of it. Let me say categorically, there is no shortage of PPE for healthcare workers in Trinidad and Tobago. The CMO has developed, as we have been saying from day one, his priority list and his protocols for the wearing of PPE. So there's absolutely no shortage of PPE. And he will talk about how we do that. The numbers to the hotline have increased exponentially. What we have done, we have brought on 10 more doctors to man this. But the hotlines are up, but we do appreciate the overwhelming need, and we'll be taking steps to increase capacity of the hotlines. Thank you very much.
Yeah,
Thank you very much, Minister. CMO?
Yeah, so in terms of the guidelines for wearing of masks, there's infection prevention control guidelines which was shared by the Ministry of Health in the early days of the epidemic to all the regional health authorities. They are responsible then to train all their staff to ensure that they wear their stuff. The monitoring usually comes out of the infection prevention control nurses, as well as the OSH departments. If you have complaints relating to clinicians not abiding by the regulations and exposing themselves and others, of course, through the RHAs, there's quality departments that complaints can be made as well. But we are asking, of course, that the IPC guidelines be followed as best as they possibly can.
Thank you very much. And now we will have brief closing statement from the Honorable Terrence Deyalsingh, Minister of Health.
Thank you very much, Candice. So I want to reiterate what the CMO said on one of the cases, that the doctors don't treat based on results. We understand the need for the family of that particular case to want answers, but we can tell you they got all the treatment. No treatment was delayed because of a test result. Ladies and gentlemen, the baton has been passed once again to the public. I would like the public to really adhere to the measures. I can't emphasize this enough. Yes, we have space, but we don't want to use that space because people are getting infected in social settings. We want to emphasize, stay home if you are ill. Only go out for necessary reasons, work, pharmacy, supermarket. Protect the elderly. Do not have private parties, whether it's in your home, whether you are rafting up your boats down the islands. Please do not test the system, because all the questions that are asked is what is the government doing, what is the ministry doing. Now it's time for a reverse. What is the public doing? Get on board with the program that this is a global pandemic where over 21 million people have died, 23 million 23,187 cases, and 804,000 people have died. We're in a pandemic. Please cooperate with us. Thank you very much.
Thank you, Minister, and everyone for participating in today's media conference. Everyone, please stay safe and follow the new normal guidelines.